This video covers the terminology for different forms of transplant, different types of transplant rejection, as well as the immunosuppressant medications that are used to prevent the acute transplant rejection. So there are 4 types of transplant that can be used, and these are autologous, syngeneic, allogeneic, and xenogenic. So autologous transplant is within the same individual. So you will transplant one part of the body to another part. For instance, you will move the saphenous vein to the heart. So this is within the same individual. Syngeneic is done between monozygotic twins, which are genetically identical. Allogeneic is done between the members of the same species. For instance, you will transplant heart from one human to another. So this is between members of the same species. And then xenogenic is between members of different species. For instance, you will transplant the heart valve from pig to human. So this is between members of different species. Now there are 4 types of transplant rejection that you will have to be familiar with. In hyperacute, which will take only minutes to happen, there are preformed antibodies against the donor tissue, and thus as soon as the transplant is connected, there would be necrosis of the tissue because the blood vessels will be occluded. And this happens in individuals who have previously received, for instance, blood transfusion from the same person, and then when they receive the transplant, their body already has made antibodies against them, and thus it would cause the hyperacute rejection. Acute rejection usually takes weeks to occur, and this is a type 4 hypersensitivity reaction that is caused by T cells of the host. So host T cells will attack the transplant. In chronic rejection, which could take months to years, it's usually due to the fibrosis of the blood vessels, which will eventually lead to the necrosis of the transplanted tissue. And then in graft versus host disease, where the time is variable, there is T cells that are formed by the donor's bone marrow. And these T cells will attack the host tissues and cause maculopapular rash, as well as nausea, vomiting, and diarrhea. Now, in order to prevent the acute rejection, which is done by T cells, there are immunosuppressant medications that can be used. And it's important to be familiar with the mechanism of action of these medications as well as their adverse reactions. So the first medication is cyclosporin, which binds to the cyclophilins to inhibit the calcineurin. And then due to the inhibition of calcineurin, there would be decreased production of IL-2. And if you recall from immunology, IL-2 is required for the activation of T cells. So therefore, there would be decreased activation of T cells. It's also very important for you to know that cyclosporin is associated with nephrotoxicity, as well as gingival hyperplasia and hirsutism. The next medication is tacrolimus, and this is acting by binding to the FK binding protein, which, similar to cyclosporin, it will inhibit calcineurin, and then therefore there would be decreased IL-2 activation. The side effect of tacrolimus is also nephrotoxicity, but then it's very important for you to know that cyclosporin is also associated with gingival hyperplasia and hirsutism. And the way I memorize it is that spores are hairy. So cyclosporin causes hirsutism. So that's how you can remember that in addition to nephrotoxicity, cyclosporin causes hirsutism. The next medication is rapamycin, which inhibits the mammalian target of rapamycin, and thus it decreases the T cell proliferation in response to IL-2. And the side effects include hyperlipidemia, leukopenia, and thrombocytopenia. And then we have azathioprine, which will convert to the 6-mercaptopurine that will inhibit the purine metabolism and nucleic acid synthesis. So therefore, this medication is associated with bone marrow suppression. And then finally, we have the muromonab, which will bind to the CD3 receptors on the surface of T cells. and thus it would block signal transduction. And moromonab is associated with the hypersensitivity reaction. And that concludes our discussion.